Thank you everybody for joining us for the Anchorage Health Department COVID-19 update for January 22nd, 2021. And we're going to start out with hearing from Dr. Janet Johnston.
Thanks, Heather. The message this week is similar to last week. Both case counts and hospitalizations continue to decline slowly, but they remain at concerningly high levels. The average number of daily cases and the number of hospitalized infectious COVID patients are similar to early October, which is when we started seeing significant increases that led to the crisis in mid-November. As a point of reference, the average daily new case counts remain 2.5 times the state's high alert level. As of Wednesday, there were 24,854 confirmed COVID-19 cases in Anchorage, 24,424 residents and 430 non-residents. There have been 139 deaths among Anchorage residents due to COVID, which is an increase of 10 from the last week. Most of these deaths occurred previously, but were awaiting death certificate review. We've also had one non-resident death. There were 412 new cases reported last week for an average of 59 per day, which is a 41% decrease over the previous week. Over the past 14 days, the average number of new cases reported per day for 100,000 residents was 26, which is a decrease of 10 from the week before. And for the third week in a row, the effective reproductive number has decreased. We're now at approximately 0.85, which again is consistent with slowly decreasing case counts. Hospitalizations have decreased slightly, with 32 hospitalized infectious COVID-19 patients on January 20th, and the number of hospitalized patients ranging from 24 to 43 last week. On Wednesday, there were 12 available staffed ICU beds, and that number ranged from 11 to 19. The percent of COVID tests within Anchorage with a positive test result has decreased again to 4.2%, which is good. But week-to-week testing volume has decreased slightly. We're asking frontline workers, including teachers who have students coming back in the classroom, to get tested on a regular basis, even if you don't have any symptoms. For everyone else, we ask you to get tested if you have symptoms or have been exposed to someone who has a confirmed case. Weekly testing for those who have a lot of interaction with the public will help identify infections quickly and will allow infected individuals to isolate and to ask their contacts to quarantine so that we can reduce disease transmission. We're also strongly encouraging travelers to get tested twice when they return to the state. There's required testing when you come back into the state, and then strongly recommended testing about a week later. This two-test protocol will quickly identify if someone comes into the state infected with one of the more transmissible COVID-19 mutations, such as the UK or South African variants, which have been publicized. So far, we have not identified any of these mutations in Alaska, but they have been identified in 24 states, including Oregon and California. So it feels like only a matter of time before they make their way to Alaska. And finally, turning to vaccines, as of this morning, at least 9,615 first doses and 5,721 second doses have been administered in Anchorage. Those currently eligible for the vaccine include long-term care facility staff and residents, frontline healthcare workers, and residents aged 65 and older. We encourage you to get tested as soon as you become eligible for the vaccine. And with that, I'll turn it over to Dr. Chandler.
Thank you, Janet. I'm going to offer a few comments about the vaccines. Studies show the COVID vaccines are highly effective at keeping you from getting COVID-19. While you'll have some protection after the first shot, your protection is much greater after the second shot. Getting the COVID vaccine can keep you from getting seriously ill, even if you do get COVID-19. These vaccines cannot give you the disease. After COVID vaccination, you may have some side effects. These are normal signs that your body is building protection. The side effects may feel like you experience with other vaccinations. For example, soreness or swelling at the injection site, fatigue or fever or headache. Most of these side effects are mild and they do not interfere with daily activities. They usually go away in a few days. Why get the vaccine? Number one, you reduce your risk of getting sick with COVID-19. You also reduce your risk of severe illness, hospitalization, and death from COVID-19. You help protect our healthcare system. If you don't get sick, you won't need a hospital bed. And finally, you help protect your family, your friends, your coworkers, and if you're a healthcare worker, your patients, and the many people at risk in the community. But it's important to remember, protection from the vaccine is not immediate. The vaccine is a 2-dose series, and it takes 1 to 2 weeks following the second dose to be considered fully vaccinated. While these vaccines are highly effective, no vaccine is 100%. The more people in our community who are vaccinated, the harder it becomes for the virus to spread in the community. But until everyone is safe, no one is completely safe. So even after we get vaccinated, we all need to practice safe behaviors that we have already been doing. Wear a mask, stay a safe distance away from others, and avoid gatherings. Thank you.
Thank you so much, Dr. Chandler, for those thoughts, and thank you, Dr. Johnston, as well. As we heard from Dr. Chandler, the vaccine is safe and effective, and this is an important tool for ending the global pandemic. And the vaccine helps to keep you and your family, our community, the economy, and our country safe and healthy. So thank you for everybody for the work that you're doing to get yourself registered when you're eligible and access the vaccine. Alaska began COVID vaccinations in mid-December of last year, and currently vaccination supply is limited, and there are not enough doses for everyone. While the ultimate goal is to have a safe and effective vaccine available to all Alaskans who want it, we're not there yet. We recognize that with the limited supply and the limited eligibility, that accessing vaccine has been difficult. And for those that have been eligible, accessing vaccine appointments has also been challenging. There is an additional resource that has been implemented to help make that process of accessing an appointment a little easier. You can visit the state vaccination, COVID vaccination website, and you'll see now that the Alaska Innovation Team has assisted the state to provide an easy-to-use tool that can help you to see accessible, available appointments in real time. The state is also available by phone or email to answer questions. We hope that these tools will provide a little easier process to accessing appointments and getting registered for when you are eligible. Thank you to the community for all of your patience as we work through this process and wait for more vaccine to become available. Until then, thank you so much to everyone in the community that continues to wear your mask, watch your space, and wash your hands. Stay safe out there and healthy. Thank you, Anchorage.